Hey everyone, this is episode 40 of the Researching Happy podcast with Dr. Matthew Iasiello. Thanks to everyone who's come along for the ride as we reach another mini milestone on the show. This episode's a few weeks late, so I apologize for that. It's been a busy couple of months. I think I've traveled interstate almost every 2 weeks for the past, 2 months or something like that. So there's lots of cool stuff going on. We've got some big papers coming out. We've got a few invited book chapters, a keynote in the US coming early next year. So at some stage, I'll try and map out some of this stuff and keep people up to date. I haven't got my camera on. It's late at night and you probably know what I look like. So instead, you can look at some of my son's Ninja Turtle artwork. Our kind of deal is that I do the dot to dot and he does the rest basically, which is a nice way to pass some time in a coffee shop together. So anyway, this is episode 40 and we're fortunate to have the very impressive Dr. Lucy Grummit from the University of Sydney. And we recorded this on just one of those days, nothing really felt like it was going right. Fortunately, Lucy really carried us through with grace. So thank you to Lucy. She's a Postdoctoral Research Fellow at the Matilda Centre for Research in Mental Health and Substance Use. Her research focuses on the prevention of mental health and substance use problems among adolescents and young adults, with a particular focus on populations that suffer disproportionate rates of mental illness, such as those exposed to childhood adversity and trauma. So as it turns out, we walked through two of Lucy's papers. It was supposed to be one, but it turns out that I got some of her work mixed up. As you'll see, like I said, it was one of those days, but all's well that ends well, basically, because the two papers told a really compelling story about the public health emergency that is child maltreatment for mental health issues, but for basically everything else. So again, a huge thank you to Lucy, who was basically the host of this episode. Check out researchinghappy.com, sign up for free and hear about upcoming episodes and submit some of your own questions to future guests. So enjoy and let me know what you think. All right, so welcome to Researching Happy with Dr. Lucy Grummit. So welcome, Lucy.
Thanks for having me, Matt. It's good to be here.
Yeah, no problems. So we've got potentially a very important topic. There's nothing potential about it. Potentially a difficult conversation. But before we kick off, let's hear a little bit about yourself. So you're in Sydney. What are you up to?
Yeah, I'm in Sydney. So I work at the Matilda Centre for Research in Mental Health and Substance Use, which is a research centre based at the University of Sydney. And I'm a postdoc there, so postdoctoral researcher. And I'm leading in that role a national randomised controlled trial of a prevention program for depression and anxiety for school-age students. So do a lot of work with schools and students to kind of roll that program out. We're sort of towards the end of that trial, so looking forward to getting stuck into the analysis soon. And then the other half of my role is sort of more like epidemiological work, trying to look at sort of risk and protective factors for mental health and substance use for young people. Really kind of focusing on childhood trauma and adversity, so things like abuse, neglect, and violence exposure in childhood and how that impacts the development of mental health and substance use problems later on.
Yeah, absolutely. And look, that'll be obviously the topic of our conversation. But is it unusual to have someone running national RCTs and doing epidemiology? Like, I like the combination. I don't think I've heard of that so often.
Yeah, I guess like the sort of my main role is the leading the randomized control trial, but I find it really hard to give up the kind of epi work. Like I really enjoy that sort of work. So I try and keep active in that space as much as possible because, as I'm sure you know, it's a very sort of fast moving field. So you sort of don't want to kind of fall out of, having your head in the literature, else you'll kind of end up, not knowing where the field's moved.
Yeah, okay, excellent. And so how did you land in this work?
Yeah, So I started with a psych undergraduate degree at Sydney Uni, where I guess a lot of people in this space often start. I did honours there as well, and I hated honours. I was like, I'm never, ever doing a PhD.
Why did you hate it?
I just found it was incredibly challenging, I think. I think honors is in many ways harder than a PhD because it's such a short time frame. Like
Yeah.
you kind of have 9 months to run a whole research study, get ethics, write up all the results and everything. And yeah, I just found it. And it's very kind of dependent. Like I had great supervisors, but they were so busy as well. And obviously, an honor student isn't always your priority. Like they've got their own work to do. So it was a very steep learning curve, I found. But yeah, so then I finished that off and I got a job actually at the National Drug and Alcohol Research Centre as a research assistant. And I really liked that role and I really liked the people that I was working with, and I liked the work I was doing. So bit by bit, my sort of supervisors were like, oh, you should think about a PhD. And at the time, I really wanted to move to New York City. So I was actually like, it's easier to do a PhD overseas than sort of be a staff member. So that kind of was the clincher in that I was able to do the first half of my PhD over in New York.
Cool.
Yeah, so that kind of sold me on it. And I did my PhD there, came back, finished it off. I guess what really kind of drew me to the trauma space is sort of, I guess, in my research assistant work, I was really seeing that these kind of early life experiences can have such like lifelong impacts on people in terms of mental health and substance use. But also that if we understand and address those early life factors, we can really have a quite huge difference on
Yeah.
individuals' lives. And childhood trauma is really one area where we see that it's we can either kind of look at how we might prevent each specific disorder, or we can kind of look back at sort of these underlying fundamental causes and address that and actually have an impact on not only mental health, but physical health, premature mortality. So it's you kind of get a lot of bang for your buck if you look into those early life factors.
Yeah. Yeah. And I guess I don't want to give too many spoilers away from where we're going with talking about your paper, but just on that, I mean, you just make such a compelling case. It's like, I'll be very disappointed if you say later that no one has taken up this research and made some significant changes because it's just so striking. Don't answer that question just yet. We'll get there in a minute. But very cool. So, most exciting parts of your work, what kind of stuff?
Yeah, I mean, as I said, I do love the sort of epi work. I love, fresh data being released and getting a chance to have a look at that. But I think, the really exciting thing about my role is that it's so varied. So I still get to do all that kind of epi work, but I can also then take what we find in terms of the risk and protective factors for mental health, translate that into programs and, disseminate them in schools, but then I can also kind of talk to policymakers and other sort of people in this space about how they can use the research. So, yeah, I think it's probably the variation that's the best bit about my role.
Sorry, it did break up just on my end. Could you just finish that last sentence?
Should I do the whole thing again? Or
No, that's okay.
okay, the last sentence. Yeah, so I think the best thing about my role is really the variation. I get to do so many different things and speak to so many different people who are really, passionate in this area.
Yeah. Yeah. Awesome. And just for people that are listening in and wondering what does epi work look like and why would someone get interested and excited about this, you're talking about basically, you said fresh data. That's like, millions, hundreds of thousands or millions of data points that you get to run through and analyze.
Yeah, exactly. I mean, it can be smaller. I guess, epi work is really just anything that uses kind of observational data. So, what we can observe in individuals and measure there and how that relates to, any number of different kind of health outcomes. Yeah. So
Very
I like
cool.
that. Not everyone does.
Yeah, no, I'm with you. I like it. Cool. And challenges. What are some challenges you're seeing in the field?
Yeah, I suppose, I mean, there's a lot, but I think the biggest one, when you're looking at things like childhood trauma and childhood adversity, is it's quite, often quite difficult to collect that data, to measure trauma and then to kind of analyze that. So, an example is that, no two experiences are the same. Every individual will experience something different, and the individuals themselves are different. But if we're to kind of analyze that in a quantitative way, we sort of have to say, like, okay, both these experiences are physical abuse, and then we'll measure it from there. But those two experiences can be completely different, and the kind of context in which they're experienced is completely different. And, we sort of also do a lot in trauma with kind of this count variable. So just, how many types of trauma have you experienced, which is sort of the best we can do in some respects. I mean, we can do better, but it's just a very reductionist approach because, the number of trauma types doesn't really tell you anything about how severe they were, how long they lasted, how frequently they were experienced. And so there's just so much individual variation in these exposures that we have to kind of, reduce so that we can analyze them. So that's tricky. And then I think the other challenge we see, maybe not so much in academia, but in a policy level is, really people not thinking that these experiences are preventable. So this very kind of pessimistic idea that, it's the result of bad parents. There'll always be bad parents, and there's nothing we can really do to change, which is completely not what we see with the data. There are many things that we can do to, prevent exposure to childhood trauma. So that's a challenge, definitely.
Interesting. I would not have predicted that one. Well, okay. So, all right. Thank you very much. Let's talk about this paper because I think I saw someone tweeting about it and was like, whoa, who did this paper? Wait a minute. Some people in Sydney. That's amazing. So the title of the paper we're going to run through, when did it come out?
Came out in May.
May. It's titled The Association of Childhood Adversity with Morbidity and Mortality in US Adults, a Systematic Review, published in JAMA Pediatrics, which I quickly looked up. That's the best pediatrics journal in the world. It has an impact factor of like 25 or something like that. So huge success to get this paper out into the world. And so congratulations to begin with.
Thank you.
Sample size was like, what is it? 20 million people or something like that.
Well, is this definitely the paper that you wanted to talk about? Because this is actually a different paper than what you... I
Is
can
it?
talk about either.
What have I done? Have I stuffed up?
No, I think you wanted to talk about the one from this year, like burden of...
Oh my goodness, I'm a moron. Yes, you're right. I've put up the wrong one.
It's okay that there's too many great papers that you want to talk about.
Yeah, well, let me pull it up. Oh my God, how embarrassing. I'll edit this out because that's just how my life is at the moment. Do they have very similar titles?
They have sort of similar titles, and they're like one's JAMA Pediatrics and one's JAMA Psychiatry. So
this is what I've done.
But maybe you did mean to talk about the pediatrics one, which is fine too.
Oh my God, Lucy, I'm sorry.
It's totally fine.
All right, I did it again. I found the wrong one. Okay, here we go. Oh my goodness.
Am I right? Was it the...
You know what? At this point, I don't know, but let's talk across both of them.
Sure.
Okay,
in many ways, they're similar.
Say it again.
In many ways, they do have some similarities.
All right, so let's talk through. You just keep publishing in JAMA. You're just confusing me. You're succeeding too much. All right. The second paper, both meta-analyses, is the burden of mental disorders and suicide attributable to childhood maltreatment.
Yes.
Okay, here we go. Let me think. I actually think I was talking about the other one, but that's okay. Let's go between both.
No, go with whatever you want.
No, let's go. So tell me about the first one, then tell me about the second one.
So the first one is from 2021,
Yep.
a few years ago now. That was while I was based over in New York. So I got to work with a couple of awesome researchers, Dr. Kerry Keyes at Columbia University and Dr. Katie McLaughlin at Harvard University. And we wanted to kind of estimate the number of deaths in the US every year that we could kind of say are attributable to childhood adversity. So these were adverse childhood experiences, so things like abuse, neglect, but also some household challenges, domestic violence and things like that. I think we ended up with something like 400,000 deaths every year attributable to adverse childhood experiences. And this sort of placed it, I think, in the third leading cause of death for
Yeah.
Americans
Yeah.
for that year. So actually around, and it was all happening around the time of COVID. So it was sort of, not too dissimilar from COVID deaths for that year. So yeah, this was kind of our first look at trying to kind of quantify this burden at a public health level of childhood maltreatment and childhood adversity, and really trying to kind of ignite this discussion to place childhood adversity on a similar kind of level as these other like leading causes of death, to kind of receive the same level of attention, that other leading causes of death get, like heart disease and cancer, given that, numbers are sort of not too far off. So that was the first one.
Yeah, absolutely. And I mean, just to get a bit of a scale of what you're talking about, if I'm not, wasn't there a statistic, something like, just don't trust me now at all, but 1 in 3 suicides could be attributed to adverse childhood
Yep. Yep.
events?
That sounds about
One
right.
in three, right?
Yeah. Yeah.
And well, let's quickly talk about, so that was 2021.
Yeah.
How was the reception to that paper?
So that one, we didn't sort of do as much, and this is a bit of a regret. We didn't really work so much with the university media departments to kind of, do a press release or anything like that. So there was some reception, and it's been, fairly highly cited in the academic
Yep.
world, but it didn't sort of receive the same level of public attention as this second paper that was released this year.
Okay.
Yeah.
It's amazing because it's like, it's just so black and white, basically. It's
Yeah.
meta-analysis of 19 studies. Sample size is incredibly huge. Like I said, whatever, two and a half, no, what was it? 20 million.
Million, yeah.
Nearly 21 million people involved in all of those collective studies.
Yeah.
Okay. So it's been picked up in the research world, but not so much.
I mean, I think the sort of major limitation of that paper, and what we really tried to correct in this second paper, is that first paper, we could never really say that childhood maltreatment actually caused
Yeah.
all those deaths.
Mhm.
We were really using the association between childhood maltreatment and things like, cancer, stroke, all the health outcomes we looked at to arrive at those figures. But we couldn't get rid of all the confounding factors in that relationship. So it's very much a paper looking at associations rather than kind of causal effects. Whereas in this one we did this year, that was really the goal. We wanted to kind of use what we knew about the causal effect of maltreatment on mental health to be able to say, no, this is the number of mental health conditions in Australia that are caused by childhood maltreatment.
Amazing. All right. So the scene is set for the correct paper. Apologies again, but actually not. I'm actually not that sorry because we got to hear both of these things, and that was a really interesting lesson learned, I guess, between the two papers.
Yeah.
So tell us about the second one.
Yeah, so the second one, we, like I said, really wanted to understand kind of the causal impact of child maltreatment on mental health at a population level in Australia. And, we knew, and there was so much literature looking at kind of associations between maltreatment and mental health. So we really suspected there was, a big public health burden of child maltreatment. But previous literature hadn't really been able to kind of get rid of those really major confounding factors like genetics or environmental conditions. So we couldn't really say that child maltreatment caused mental health problems. But then last year, one of my collaborators in the UK, Dr. Jessie Baldwin, released this amazing meta-analysis that did exactly that. So she looked only at quasi-experimental studies, which are study designs that kind of allow us to get at causality without using a randomized controlled trial, which obviously in maltreatment, you can't, randomly allocate some children to receive maltreatment and others to not. So it's really not possible to run a randomized controlled trial. But what has been used in the literature are things like, twin studies or adoption studies that kind of allow us, for example, twins that share the same genes, but one of them is
Hmm.
adopted out into a different environment, kind of allows us to isolate the effects of genetics and environment, and so we can arrive at the remaining kind of causal effect. So this is what Jesse's meta-analysis did, and there's lots of different quasi-experimental designs. So the meta-analysis is great because it kind of triangulates across all those different designs and ends up with sort of this average causal effect. And it was smaller than, associations that had been
Sure, of
previously
course.
found. But there still was, a small causal effect of maltreatment on mental health conditions. So, I mean, Jesse's meta analysis was awesome to researchers in the field like me. But, they sort of reported a Cohen's d of 0.31, which isn't really, I guess,
It's like a small to medium effect size, I guess, or maybe
yeah,
even just small.
yeah. But it also isn't sort of readily kind of translatable to like policymakers or the
Okay.
public. Like it's not, it doesn't really tell you kind of what you want to know about
Okay.
the impact of maltreatment. So then for this paper, and Jesse was one of the co-authors on this paper, we really wanted to take that, causal effect and look at what that meant for the population mental health of Australia. So that's kind of what we did. We took the effect size of that relationship between maltreatment and mental health, and we sort of linked it to a couple of population-based statistics in Australia to kind of arrive at, the number and proportion that were caused by childhood maltreatment.
Yeah. Okay. So talk us through some of the results.
Yeah, so I mean, yeah, quite sobering, really. But we did find a really high proportion of mental health conditions in Australia are caused by childhood maltreatment. So from sort of 20% of depressive and anxiety disorders, 30% of substance use disorders,
Hmm.
39% of cases of self harm, and 41% of suicide attempts in the population
Far out.
were caused, yeah, by child maltreatment. So, yeah, and this totaled more than 1.8 million cases of mental health disorders in the population. So, going back to what we kind of started with, it's like these early life experiences have a very profound impact on not only kind of individual health, but what we see for population mental health in Australia.
Yeah. And so, I mean, just as a random side note, I guess this doesn't really matter, but you said that the proportions were smaller, or maybe you were talking about that middle paper by your colleague, where the effect was smaller than it was in the association studies, but this is actually higher.
So,
Like for example, for suicide, you said it's 41%. It was 33% in your first paper or something. Or am I
it,
misinterpreting?
it was a Cohen's d of 0.31. So yeah, it's a sort of different statistic.
Okay. Okay. Now, in terms of the your first between your first and second papers.
Oh, yes. Yes. Yeah, I think so. We did do it a bit differently in the first paper. It was adverse childhood experiences
Hmm.
overall, and this one was specifically child maltreatment. And obviously,
Gotcha.
they were different contexts as well. That was in the US, the first paper, and this is in Australia. So
Of course.
they're
Okay.
not
My apologies.
directly comparable, but yes, you're right. They
Yeah.
were.
Okay. I mean, like we were sort of saying before, I've got two little kids and a third one on the way, and it's like you wouldn't think that you need a study to sort of. We talk a lot about scientism on this podcast, and the thing of I'm not sure if you're familiar with that term of basically need like relying on science more than what science kind of can deliver.
Mm,
But this idea of like, do we need a paper to tell us to protect kids in this country or in any country?
yeah, yeah.
And so should we need it? Probably not. But this is the one. My goodness.
Well, yeah, I feel like, and we might talk about this, later when we talk about how the paper was received and things like that. But there were a few comments when this paper came out around, this is so obvious, like, did we really need to do a study to look at this? Yes. So, when this paper did come out, there were a few comments, and I spoke to a few journalists about, isn't it quite obvious. Like, wouldn't we expect this? And do we really need a study that can tell us all this? Um, and I think the point you make is totally accurate. I guess, you know, for me, it was sort of about like, I agree, it is really obvious, but if it's so obvious, what are we doing about it? Like, have
Exactly.
we already started to, do the things that this paper calls for? And the answer is no. So it's kind of like, you know, or like, within my field, this is what I can do. And yeah, I agree. I think we've moved beyond this idea that we need to produce more research on
Mm.
how bad childhood trauma is. But I think this is the way we get kind of the public and policymakers to really take note.
Yeah, look, I agree. I agree with you.
Yeah.
And it's also like, you might say it's obvious, but it might not be obvious to the degree of the impact, you
I think
know?
that's true as well. Yeah. And also, I mean, the other side of the coin is there are many children who experience trauma who don't develop mental health problems and don't develop any kind of problems. So it's sort of like we know these associations are there, but then obviously not, it's not a one-to-one relationship,
Yeah.
right? So it
Yeah.
can increase your risk, but it doesn't actually mean that you will develop any problems if you've experienced these events. So we still need to kind of quantify that impact and really understand that relationship.
Hmm. Wow. And so just to be really, really specific, how did you define maltreatment in this study?
So we defined it as physical, sexual, or emotional abuse and neglect.
Yeah.
Yeah, so because it was kind of a data linkage study, in essence, we had to really make sure we were matching what had been used in the kind of causal effect of maltreatment and make sure we match that to the population level statistics we have on maltreatment. So that's the Australian Child Maltreatment Study, which was
Hmm.
released last year, which is sort of the first look at the prevalence of maltreatment in Australia.
Far out. What did you think when you first when you would have clicked? What did you do? Like what? I don't know. What stats program do you use?
Well, for this one, we didn't even need a fancy stats thing. We just had like Excel formulas because we could just link the effect size
Okay.
to the PAF through a simple formula. So it's funny that like the methodology for this study is really simple. The difficulty is making sure all the data sources aligned perfectly
Yeah.
and we could actually link them. But yeah, once you had them, it was just like whack it into an Excel.
Okay. I guess my question is almost like when you click the button, but I guess in Excel there is no button.
When you
When
hit
you
enter and
when
the
you hit
yeah.
enter and you saw some of these numbers coming up, what was your immediate reaction?
I think I was surprised, certainly, that they were so high. We did really think that, using this causal effect size, it sort of should be fairly small, given the causal effect itself was quite small. What sort of led to these, you know, statistics being quite high proportions is more so that the prevalence of maltreatment in Australia is so
Right.
high.
Right.
And that's really concerning, in and of itself.
Hmm.
So yeah, I think surprised, but probably, less surprised than maybe people outside this space. Because obviously, everything I've done in my career up to this point has really looked at just how big of an issue this is. So
Hmm.
certainly I was surprised and sobered to see these results, but I wasn't totally shocked, which is
Okay.
quite sad.
Yeah. Anyway, all right, cool. So what to do from here, I guess, is so you've laid out across a couple of studies and along with your collaborators, this is a huge issue. It's preventable.
Mhm.
My naive hope would be that 10 politicians call you the next day that this study comes out and say, Lucy, what do we do? I'm assuming that didn't happen, but maybe something like it did.
Yeah, it didn't happen quite like that. So initially there was sort of more like media interest and
Yep.
interest from the public, which is great, to give this kind of message a bit of a profile and allow us to actually get the message out there. So it was quite well received and we got a lot of emails from, people with lived experience who were just relieved to kind of see that this work was out there and that it was getting attention.
Really?
Yeah, which kind of goes to tell you like this thing that's so obvious, that we talk about, it's like it actually doesn't get as much of a profile as it probably deserves, in the landscape. And then, yes, a few sort of the government sort of came through. So we have spoken quite a bit to certain government departments, and that is really encouraging to think that they are listening and they do want to provide solutions in this space. But I suppose, it was published back in May, so there hasn't been a huge amount of time lapsed since then. So I'm hopeful that we'll see some concrete actions. But yes, like you say, we haven't seen anything in particular yet.
Yeah, no, I mean, it's super early. I guess I'm just being pretty stupid at the moment, but
No.
that's okay. So then let's talk, what would you want to see? What are the changes that you would like to see, whether it's practice, policy, stuff parents can do at home? Like, I'm all ears.
Yeah, I think that really is kind of the main implications from this paper, right? That we want to be preventing both childhood maltreatment from occurring in the first place, but then we also want to make sure that we are intervening with children who've already experienced maltreatment, to prevent kind of further harm.
Mm-hmm.
So I think kind of the first thing I want to see is this sort of shift in the narrative. So, not kind of thinking that maltreatment is just something bad that happens to like some unlucky kids. It happens to, over 50% of Australian children. Which is just completely
That is
ridiculous.
heartbreaking, yeah.
Clearly not just, some like bad parents. Like we can't have 50% of parents in Australia being bad parents. That's just not what's happening. So we need to sort of be recognizing the kind of social and structural determinants of childhood maltreatment, because that's obviously where we'll be able to intervene if we know what causes maltreatment. So I would really like it to be treated as a public health emergency, given that, the proportion statistics that I mentioned earlier are similar to what we see for things like, high blood pressure accounts for 23% of heart attacks globally. So we've seen childhood maltreatment accounts for kind of at least 20% of mental health disorders. So, if we are serious about addressing mental health prevention, then we need to be, delivering as much kind of resources and investment as we did to treat, hypertension, or, you can make similar comparisons with kind of smoking and cancers. And, I think everyone would recognize that child maltreatment doesn't get nearly as much attention as those public health issues. So that's kind of the first thing, just changing the thinking.
Sure.
I think then we need to look at how we can prevent exposure to maltreatment altogether. And sort of I think, biggest way we can do that is policies that really ease stress on parents. So we've seen in the US things like expanding paid parental leave, improving access to childcare, subsidizing health insurance. Obviously, that's a big one for the US. Even increasing the minimum wage and improving housing affordability all actually show reduced rates of child abuse and neglect. So, these are big, broad structural changes that can potentially avert, millions of cases of maltreatment and, in the long run, mental health disorders in the population. But we also have, effective programs like home visitation programs or parent education and support programs that, provide parents with support and education, and also show reduced rates of child abuse and neglect. So I think there we need to make sure that families with, the greatest need are actually able to access those programs, but also work to kind of address the stigma that surrounds, seeking help as a parent. I think many parents are, these programs are available and they don't access them, maybe because they, feel kind of stigmatized for saying, I need support, I need help with this.
Mm-hmm.
But also acknowledging that there's a huge postcode lottery in terms of what's available to parents. Some will have access to different programs just based on, where they are geographically. And I think, also ensuring parents have effective treatment for their own mental health and substance use problems is really critically important as well. So there's a lot that we can do in that kind of, policy-based prevention, and, helping to support parents and families that would go a long way to reduce rates of child abuse and neglect. So that's kind of, in the sort of, I guess, primary prevention, where you're kind of trying to prevent the exposure from happening altogether. But, we also know that for children who do experience maltreatment, like I said, many of them don't develop any problems with mental health or, substance use, which is the other area of my research. So I think we need to also make sure that we can intervene quite early with those children and, ensure healthy development through things like, promoting social relationships. We know that if they have even just one adult in their life that is a safe and nurturing relationship, they, that's sort of the most consistently identified factor that protects
Really?
against mental health and, substance use problems. So, that can go a long way. That could be, a parent, a teacher, sort of any other person in that child's life is really important. And then finally, in our schools, we can really promote kind of healthy coping skills and promote kind of pro-social relationships that go a long way as well. So, I mean, I could talk all day about this. There's so many things we can do. So that's why I do get frustrated when sort of people see it, maltreatment, as like this inevitable thing that's kind of always going to happen and always going to, really affect the mental health of Australians. There's still so much we can do, before we take a kind of pessimistic attitude on this.
Yeah. And I guess if you had to say, like, what's the most obvious first step, like, of all those potential solutions, is there such a thing? I don't know. Maybe it's an unfair question.
No, I guess there's sort of a difference, and I think this is probably where we get stuck a lot of the time, between kind of what is easy to do, like, straight away, that could have a big benefit, versus what is maybe going to take a bit longer but could have a much bigger effect. So I do really think that those kind of economic supports and economic relief to families is probably most likely to have a really big effect.
Yeah.
But then I also think there's things that we're sort of starting to do, this trauma-informed schooling, trauma-informed practices in, primary care, that will actually go a long way to preventing mental health as well. Not just for children who experience maltreatment, but all children. We know that they're really important things that are really effective. These strategies that we can put in place now. So, yeah, I think anything we do is better than sort of doing nothing.
Yeah, that's for sure. Yeah, I think I probably go into like a negative spiral a bit when it's like, I mean, the big one for me, I'm glad that you focused on it, was parental stress. And it's like,
Mm-hmm.
probably we're not that different in age. I would imagine our parents could mostly, like, their generation could mostly have gotten by on a single income. I don't care whose income it was, whatever, but on a single income, you could have gotten away with it, which just means there is just more time for someone to be around. Now we're in an environment where I think you basically couldn't raise a family on a single income, or if you did, it would be extremely difficult. We're semi trying that at the moment. And I just wonder, but that's obviously an incredibly difficult thing to be shifting at an economic level. Like,
Yeah, I mean, it is. I guess the beauty of kind of the economic policies is that often, preventing child maltreatment is sort of, the policies themselves weren't designed to actually do that. They were designed for something else, like,
yeah,
improving housing
yeah,
affordability
yeah,
is its own issue. But then it has these sort of flow-on effects for preventing child abuse and neglect, and things like paid parental leave as well. So,
yeah,
I think while they may be, bigger picture things to do, they obviously take more resources in terms
yeah,
of, money and rollout and things like that. They just have the potential to have such big impacts that, they do kind of recoup the benefits
yeah,
as as we go down the life course of these policies. So it's I guess that kind of age old problem with policy, and it's like governments often want something where they'll reap the benefit within their term or
Yeah.
within the short term. Whereas I think in science we sort of do see that we look at those long term effects, and that's where we really see these
Yeah.
policies kind of shine through.
Yeah, that's a very frustrating mismatch. It's been the topic of probably a bunch of episodes. I should stop hoping that someone solved that problem. And you may have said it, I might have missed it, but did any of your research sort of talk about the difference, any protective factors between, say those kids who experienced, well, young people who experienced maltreatment who went on to develop a mental illness versus those who didn't? Were you able to do sort of any differentiation between those two groups?
No, not in this paper. A lot of my work does kind of look at what those protective factors might be, and I guess what I said about kind of safe and supportive relationships and environments being
Yep.
kind of the key
Yep.
to recovery. I think that's really where we see a lot of difference. So that is quite encouraging because what I'm looking at the moment is sort of school level factors. So, how much a child feels like they belong and are accepted in their school is actually a very important predictor of, mental health symptoms in students who've experienced trauma. And there's lots of protective factors like that. So I think, the more we can try and understand what those protective factors are and then sort of develop strategies or programs around them, the better place will be to kind of address this problem of child maltreatment and mental health.
Yeah. Far out. Um, is it well funded, would you say, in Australia, this kind of research?
No.
Okay. I mean, every researcher will say that, I think, but
Yeah, that's the thing. I mean, I think in general, mental health prevention as an area doesn't get enough funding, and therefore, even that tiny kind of amount of funding that it does get, even less of that, gets pushed upstream to kind of childhood trauma. But yes, like you say, acknowledging that kind of every researcher will say their area doesn't
no,
get
no, I'm
enough
with you. I'm
funding.
with
But
you.
my director always gives the statistic that mental health, causes, I think it's like 17% of the total burden in Australia and gets less than 5% of the research
There you
funding. So,
go.
you can certainly see that there's not enough funding when you look at it like that.
She seems to definitely be if we're talking about the same person, I think we are. Marie, I'm assuming.
Yes,
Yeah. She's definitely seems to be a good advocate for some of this work.
she is a fantastic advocate.
Cool. And so does any of this tie into your RCT work?
It does, yes. So the RCT work, it was an existing mental health program that we have refined and updated, and we've really worked to make it trauma informed. So sort of, recognize the widespread prevalence of childhood trauma and also the impact on mental health, and kind of work that knowledge into the program to sort of help address that relationship between childhood trauma and mental health. So yeah, it does. It's quite, because the RCT is a universal program. It's still very kind of it doesn't address trauma in a lot of detail, but through kind of psychoeducation and sort of CBT skills practice, the students sort of learn how childhood trauma might impact their mental health, and resources and ways they can kind of cope with that effectively. So it's related, and that's kind of what I like about, I think epi work is really interesting, but it's most important when we can take what we find from epidemiological work and actually implement that into, real world
Yeah.
programs and strategies that actually get out there and reach people.
Yeah.
Yeah, so yeah, it's sort of a nice marriage of the two parts of my
No,
role.
that's cool. I think I like people that wear two hats like that work together. It seems to be where very productive outcomes come from.
Mm.
I'm just thinking out loud. like a really skeptical person would look at this and say, like, we're just loosening the definition of what maltreatment is or something like that. Like we're just anything counts as maltreatment these days, that kind of idea. This is just a random flow of ideas. Just tell
Sure.
me what you think. But it's like, even if that were the case, and you can respond to that, is that the case? Number one. But number two, even if that were the case, you're still seeing a massive burden coming from that maltreatment, even if it were quote unquote a low level of abuse. Or I feel stupid even saying something like that, but do you get where I'm coming from? Like,
Yes.
even if we totally lowered the standard of what counted as maltreatment, we're still seeing a huge burden. So it isn't a low form of maltreatment. Does that, get where I'm coming from?
Yeah, I think so. I guess, it's true that like people will, you know, when we collect data on maltreatment and experiences of childhood trauma, there will be a lot of variation in what people report. So there's certainly a subjective element to this. But research has kind of looked at differences between kind of child maltreatment as coming from like childhood protective services. So,
Mm-hmm.
whether there was a report and that's been substantiated and stuff. And also looking at, self-reported maltreatment. And, we do see that childhood protective services don't pick up all cases of maltreatment,
Mm-hmm.
and the cases of maltreatment that are self-reported have much stronger associations with mental health, which you might, imagine. But it's kind of like, if mental health is what we want to prevent, then it makes sense to be addressing those subjective reports of maltreatment that are
Yeah,
so strongly linked to mental health.
exactly.
And there's work in the Australian Child Maltreatment Study as to whether kind of more recent cohorts are kind of more likely to say they've been maltreated, but we don't really see that. And there are kind of definitions of maltreatment that have been quite consistently applied in the literature. So
Mm.
yeah, I think I know what you're saying, but yeah, I don't think that's sort of something that would explain kind of the results or
No, exactly. That's
yeah,
exactly my point. I'm just fighting
yeah,
an imaginary battle with imaginary skeptics in my head. I don't know why. But I,
yeah,
I like the point that, yeah. Okay, let's go. All right. What's next? What's next for you?
yeah.
A few more
Sorry.
JAMA publications
Well, hopefully that would be nice.
just to confuse people like me.
No, so I've sort of got a few things on the horizon. So, like we mentioned, I'll be wrapping up the randomized control trial over the
Hmm.
next few months, and then we'll be able to actually look and see whether these kinds of interventions can, prevent either the onset or the escalation of depressive and anxiety symptoms. Um, Looking at the Australian National Study of Mental Health and Wellbeing data, looking at rates of childhood trauma in that sample, and then also looking at more kind of protective factors for those children who have experienced trauma. How can we kind of buffer them against developing kind of depression or anxiety later on in life? And like I mentioned, school belonging is one really promising factor that we're looking at now. So yeah, trying to understand how that is, that could be promoted in schools is really important. So yeah, a few things on the horizon, lots to look forward to. Yeah.
Awesome. All right. Well, thank you so much for your time. My apologies that this has probably been a little bit interrupted with some internet outages, and not to mention I started the introduction with the wrong paper. That's okay.
No, I think you actually fit quite well. So
Let's pretend that it was on purpose. And
no, thank you so much for having me. It's been great to have a chat, and yeah, yeah, thank
no worries.
you.
Where can people find you? Are you online, or is there a website you would
Um,
direct us to?
No, I'm online. I mean, the Matilda Centre has a website, so I'd be listed up there. But yeah, LinkedIn, you can find me. I'm still on X, but I've been told by our media person not to direct people there, so maybe LinkedIn.
All right, done. All right, thanks heaps, Lucy.
Thanks, Matt. Bye.